Everyone to our first Optimizing Newborn Nutrition webinar of 2024. We are going to jump right into today's presentation. After the presentation and question and answer session, we will have some announcements and additional updates. We have Teresa McCullen from WellStar MCG and a member of our GaPQC neonatal committee who will be introducing our speakers for today. Teresa?
Hello, everyone. My name is Teresa McCullen, and I am an IBCLC here at WellStar MCG, and as Linda mentioned, a member of the GaPQC committee. And I am pleased to introduce my colleagues, Dr. Alice Caldwell and Elizabeth Young. Dr. Caldwell is currently the director of the newborn nursery and is an associate professor of pediatrics here at the Medical College of Georgia. She earned her BS in zoology from Duke University and then came here to the Medical College of Georgia for medical school and for her pediatric residency. She is a leader in the Georgia chapter of the American Academy of Pediatrics. And a fun fact for everyone is that she also has a special interest in breastfeeding, and she became an IBCLC in 2012. Beth Young became our perinatal nurse manager early 2023, and she holds 3 national nursing certifications, one in inpatient obstetric nursing, antepartum nursing, and in electronic fetal monitoring. Beth has been at the helm of several initiatives designed to enhance patient care, quality, satisfaction, and safety. Dr. Caldwell and Beth are both building on several decades of foundational work, physician and nursing leadership coordination around optimizing newborn nutrition. The Medical College of Georgia has a long history of physician engagement, particularly around breastfeeding. So everyone out there, take heart that the seeds that you are planting now across the state in this initiative will take fruit over time. With that, I'll turn it over to our speakers.
I'm Dr. Caldwell, and can y'all hear me? Can y'all hear me? I don't know.
Yes, you've got a little echo though, Dr. Caldwell.
Oh, okay. All right.
That's better. Go ahead.
Okay. So now we're known as WellStar MCG. So we're back to our original name. Our hospital serves a diverse, predominantly high-risk obstetric patient population from the central Savannah River area, both east central Georgia and the corresponding area in South Carolina. We are a regional perinatal center as designated by the Georgia Department of Public Health. We are Georgia's first hospital designated by DPH as a level 3 maternal care center. It's below, it's a maternal level 4. Yeah. Okay. I see that. I'm reading the other notes, the show notes. Okay. We have the region's only obstetrical emergency department. We have 24/7 in-house obstetrics and anesthesia coverage, and we have a 45-bed level 4 NICU located within the Children's Hospital of Georgia. We have about 1,700 or more births a year, and both our perinatal and NICU teams are participating in the GaPQC ONN initiative. We offer couplet care from the delivery room to discharge, only separating baby and mother when medically necessary.
All right, so because of our commitment to quality improvement, we here at MCG WellStar, formerly known as Augusta University Health, have enthusiastically participated in the Georgia Perinatal Quality Collaborative since the beginning of its development. And so this includes all 5 initiatives of obstetric hemorrhage, severe hypertension, cardiac conditions, neonatal abstinence syndrome, and optimizing newborn nutrition. In fact, this past April, WellStar MCG Health was recognized by GaPQC for being an early adopter of all AIM quality initiatives. So looking just at an overview of some of the things that we have that are current ongoing with our initiatives, all nurses, technicians, physicians have completed didactic hands-on education. We started this with our participation in Georgia 5-Star program, and we're transitioning resources to the Optimizing Newborn Nutrition initiative. In fall of 2021, the the initiation of the Golden Hour with immediate skin-to-skin contact with moms and newborns to assist with the initiation of early breastfeeding in the first 30 minutes of life. Lactation and RN led patient education of the benefits and support of this after delivery. In June of 2023, we rolled out a 90-minute interactive breastfeeding CEU class for our RNs and PCTs. Lactation updated nurse-driven patient education to present individualized hands-on education to assist with early initiation of breastfeeding or pumping. Lactation makes weekly follow-up phone calls for all breastfeeding mothers to answer questions or concerns to help mothers succeed in their feeding goals for their newborns. Lactation consultants are scheduled weekly time in the outpatient clinic in order to ensure early breastfeeding education during the prenatal period and continued support into the postpartum period.
We were approached early last fall about a GaPQC site visit, and it was arranged for November 2nd. In advance of the site visit, we were sent a link to a confidential survey to share with our staff. The day arrived, and we started out with the team from the GaPQC meeting with our leadership team to share more about the Optimizing Newborn Nutrition Initiative and to hear about our work. The GaPQC team conducted brief interviews with staff members and families, and Beth conducted a tour of the unit. The team also visited our NICU and had lunch with team members and pediatricians from our outpatient clinic as well. We were provided with a report containing accolades and customized resources in the areas we are working on. And this is a picture of our team. This is who we met with the day of the site visit. And including the following people: Kimberly Basso, who's the Director of Pediatric Patient Care Services; Beth Young, who's been speaking at this meeting, and who's the Perinatal Nurse Manager; Jenny Simmons, who's an Assistant Nurse Manager in L&D; Danielle Cassingham, an Assistant Nurse Manager as well; and then myself, I have been the Director of the Newborn Nursery; Susanna McBride, who is one of our newborn nursery NPs, very essential person in our group; Teresa McCullen, who is an IBCLC, who did the introductions; and Sue Ellen Abney Roberts, who's the Clinical Outcomes Manager.
A lot of our success is due to our fantastic lactation team. Not only do they provide patient care to our unit, but also the 45-bed NICU and the Children's Hospital, as well as running a telephone warm line for outpatient visits for our discharged patients. They train our staff as well as medical trainees, as we are a teaching hospital, and some of their training that they offer includes regular updates of curated breastfeeding and lactation education to the perinatal staff. Multidisciplinary Lactation Journal Club is offered campus-wide. We have assisting new nurse residents with gaining lactation-related competencies in our unit nurse residency program, and shadowing and training opportunities for all sorts of medical trainees, including pediatric medicine, obstetrical, and of course, neonatal. Here's just some of our photos that are detailing the work that our lactation team does. The picture on the right is during our skills fair this past year, where we are going over some breastfeeding and newborn nutrition optimization training.
As we mentioned, we were provided a link to an anonymous staff survey to share in association with the site visit. We were gratified to see that the staff who responded are familiar with breastfeeding policies and procedures and passed an annual competency evaluation and endorsed many of the recommended teaching and practice elements. The team interviewed 2 families and 4 staff members. Themes included that the nursing staff appreciate the support from leadership that has facilitated their training and competency in supporting patient feeding choices. Nurses seemed to be clear on steps to take when latching was difficult, such as putting the baby skin to skin, trying different positions, and hand expressing colostrum, and how to support establishment of lactation when mother and baby are separated. Families were interviewed and they seemed confident that their needs would be met with our services. One mother of a 2-hour-old infant had already had the baby breastfeed twice. We conducted a tour of our unit, including 4 OB ED beds, 8 LDR beds, a surgical suite with 3 ORs, 2 AP LDR swing rooms, and 14 private rooms for the care of antepartum and postpartum patients. Our respite care nursery that is utilized for newborn procedures we also saw, and our special OB emergency department, which provides care to women from 16 weeks of pregnancy until 6 weeks postpartum for obstetrical issues. We also shared where our breast pumps and supplies are stored and milk is stored and or prepared. We were happy to show one of our first Mamava pods.
Mom of Us.
Oh, Mamava, sorry. Pods that are located across the hospital and clinic area and demonstrate our commitment to lactation accommodation in the workplace and for visitors. If you are familiar, Mamava pods meet the requirements of all workplace and public space lactation laws and come with an easy to clean built-in seating, lighting, shelves, mirror, coat hook, outlets, and fan. Employees and visitors can access pods with the Mamava app. There's no need to track down a key and are simple to sanitize. Our employees and visitors love them, and we didn't have the expense of building out special lactation rooms. You also see these in airports too.
Yes.
Okay. In our report, we were praised for several particular areas in which the GaPQC team felt our institution is excelling. We are continuing to build on a deep foundation built over several decades at MCG. Physician and nursing leadership are committed to supporting the breastfeeding goals of patients. We have several physicians on staff who are also board-certified lactation consultants. Observation of the golden hour is well established. Reaming in is the standard and rounding happens at the bedside. Lactation care and support of lactating mothers readmitted to the hospital is part of the standard of care, as well as to patients admitted in antepartum in our obstetrical ED. Coordination of care outside the perinatal department is prioritized.
And I will say, with our lactation team, they're amazing to go out to different areas of the hospital because we are a teaching facility. We are level 4. We get the sickest of the sick moms. So we have patients who deliver, who are intubated in the ICUs, and our lactation consultants go out and teach our ICU critical care nurses how to pump and how to hand express. We had a patient that was in the ICU post-COVID who was on the ventilator, but they knew she wanted to pump and provide breast milk to her neonate. And so we actually had lactation trained and made a schedule for these nurses. It was amazing to see. So just one of the ways that we just move outside of the perinatal world into helping our patients who are critically ill. Our nurses are well resourced to support breastfeeding as the norm, reflecting leadership priorities. There are many training opportunities to learn the basics and to stay up to date, and the Journal Club offers to go beyond foundational education to look for special clinical topics. Our staff is also comfortable with teaching hand expression when indicated, which is a strategy that supports exclusive breastfeeding and reduces the need for supplementation. It provides an opportunity for teaching about feeding cues, frequency, and volume recommendations for newborns. Our lactation staff paradigm is to train all nursing staff to support the normal course of breastfeeding, including techniques to support common issues such as difficult latch, and IBCLCs are available to assist with issues.
We also want to shout out to our skilled and diverse lactation consultant staff. We have 3 IBCLCs. One is Spanish speaking, helping to ensure our lactation care is culturally competent. Our lactation consultants offer a telephone warm line and outpatient appointments, as well as covering perinatal, our 45-bed, level 4 NICU, and the Children's Hospital. So they're very busy. They go beyond, above and beyond. Let's see.
Oh, God.
Okay. Our lactation consultants our IBCLCs design and deliver education and training opportunities such as regular staff updates, a journal club, ensuring our new nurses are competent in breastfeeding support and shadowing for medical trainees.
We also have supports built into our systems and structures, such as sufficient breast pumps in-house. We also ensure supplies are ordered and available for our patients, including manual breast pumps for them to go home with in the intermittent during the time that they're waiting to get a breast pump. Also providing breast pumps for our moms in the NICU who can bring their parts with them and pump while they're here visiting baby in the NICU. We have also written a breastfeeding policy that is reviewed regularly and includes recommendations for breastfeeding and for safe breastfeeding and sanitation and sterilization.
Some suggestions from the team that we are considering. The GaPQC team recommends that Wellstar MCG at Augusta University Hospital consider implementing the following. Increase collaboration with the local agency for the Supplemental Nutrition Program for Women, Infants, and Children, or WIC, which is a major access point for lactation education support both prenatally and after hospital discharge. The district breastfeeding coordinator is Gwen Williams, who can be reached at the, I don't know the number, 706-721-5930. The WIC breastfeeding training curriculum is available as well for your review and to coordinate messaging. They also suggested developing a multidisciplinary lactation breastfeeding committee or task force. Representatives could include OBs, dietitians, nurses, techs, pediatricians, academicians, and leadership. This committee could write and review policy, work on quality improvement across departments. The unique setting as a teaching hospital and with the Children's Hospital sharing our campus provides many opportunities for collaboration. Your institution is fortunate to have multiple physicians with deep experience in human lactation. The CDC's biannual maternity care practices and infant nutrition and care survey, which opened this spring, is a good opportunity to begin. You can learn more about the infant survey and the comprehensive and confidential report that they sent to respondents. We also were suggested to build on our clinical lactation department by increasing staffing to meet AWAN and AAP guidelines regarding IBCLC staffing, especially considering they cover CHOG as well. Kudos for having a Spanish-speaking IBCLC on staff. I completely agree with that. And then there are AWAN, I don't know if I said that right, staffing standards as well as AAP guidelines. We also should capitalize on opportunities to increase access to prenatal education for our patients. Work with the AU-associated OB clinics and WIC to assess needs and opportunities. Identify an OB champion or several. Collaborate also with the pediatric clinic. I mean, that's also true as a pediatrician. The GaPQC annual meeting may provide educational opportunities on this topic. The ACOG statement on the physician's role in human milk feeding can also be found in it. The SMART aim our mother-baby team has chosen is for the Optimizing Newborn Initiative is to decrease formula supplementation from 56% to 31%, by September 1st, 2024. Our site visit report included curated recommendations and resources to help us achieve our SMART aim.
Sure.
Okay.
So particular to our SMART aim, we are considering some of the following strategies. As part of the site visit, we're offering specific recommendation resources for designated SMART aims to decrease formula supplementation from the 56% to the 31% by September 1st of this year. We are using the approach of greater education for our staff, which will increase education for our patients. A better understanding for our patients mean that they're making more informed decisions and that they also feel comfortable asking questions when they don't feel that they have all of the answers. We are also using formal lactation risk assessments with our lactation consultants when they are seeing our patients in order to optimize the triage of lactation care and medically appropriate supplementation of breastfeeding in the need of the newborn. We also have we use donor milk in our NICU rather than formula to supplement. So our babies in the NICU are receiving human milk to help decrease their risk of neck. And it's something that is a great consideration for these small babies who are at greater risk for those. Also considering doing a root cause analysis as part of a monthly audit to collect data, and use a multidisciplinary lactation breastfeeding committee and a task force to discuss issues, roadblocks, opportunities, and challenges. Especially on night shift where our nurses don't get as much opportunity to drop in with our educators or with our OBs or our newborn attendings. So they get an opportunity for enhanced education on these things. So that's us in a nutshell.
Oh, okay. Oh, and that's next.
Just pictures.
Oh, that's good though.
Hey, Claire. Sorry, my computer's messing up. There we go.
Thank you,
Oh.
Beth and Dr. Caldwell, and to the GaPQC for inviting us to share our work. And I hope you all have found something in this presentation that's inspiring to your work. We can now answer any questions, and then I'll pass it to Claire for some updates and reminders.
Claire, you're on mute.
Thank you. Thank you all. Sorry, I don't know why I have a blind spot about being on mute. It was really fun to be part of the team, to come and meet you all. I have long wanted to come tour, and so it was a good excuse. Thank you all for having us and for your presentation and sharing some of the great work you guys are doing. Does anyone have questions? I know I fielded a text or two about the journal club. Teresa, would you mind expounding a little bit about the journal club? And I'll mention, when we did the staff interviews, this is something that all the nurses mentioned. I know it's probably hard for nurses to get to meetings like that, but just even the idea that it was offered, I think is meaningful, even if folks can't attend every time. Can you share a little bit about how that originated and what it looks like?
I sure can. And I have to it has been long, and by long, I mean decades long, kind of dream of mine to provide a journal club. Long ago, I used to work in basic science, and so journal clubs were part of what we did. And I always felt that it was a good way to help. There's so much out there, but to help give folks some information about the latest evidence-based information. And so the journal club came to light. The lactation team and I, we just decided to do it. And so we chose a topic, and I don't even remember. The first one may have been HIV and breastfeeding. We've done HIV and breastfeeding. We have done THC and those products. We've done on care for LBQT plus families. So we just choose a topic and we present 30 minutes on the journal. It's kind of, we call it a hybrid journal club because it's not strictly a journal club. We're discussing topics, and sometimes it comes from a journal. Sometimes it will come from updates from the American Academy of Pediatrics, for example. And so we do it online. We do record it. During World Breastfeeding Month, during August, we actually did an in-person presentation with the snack cupcakes that were appropriate for a breastfeeding journal club. But I'm excited to hear that it's something that people are finding interesting. We're hoping to build the number of folks that participate.
Thank you, Teresa.
You're welcome.
I love that. I mean, I tend to be like an over perfectionist, so I want to like plan everything out really perfectly, but I'd like that it can just be kind of like, instead of it being a formal presentation, that it's more discussion based. Jean is asking how often you schedule them.
Hey, Jean, I was about to type an answer. We started out doing it monthly, and then, as you might imagine, it got a little intense, and so then we're now doing it every other month.
Yeah, it sounds like a great kind of quarterly or every other month nice topic, and it could be rotated with other, or part of a bigger kind of education plan.
Yes.
Dr. Pius asks the team, and I know Dr. Caldwell will need to excuse herself at some point in the next little while, but if she's still there, or Beth or Teresa, if you can answer, could you share experiences in terms of barriers for breastfeeding initiation and continuation for Hispanic families in your area? Any tips for successful transition from the hospital to home when trying to maintain exclusive in this population? Beth, do you have any input on that, or Dr. Caldwell?
Oh, okay. Well, we really work with that a little bit because it seems like some of our Hispanic patients like to, it's hard to get them past the idea that they don't have enough breast milk at first because they may not see it. But we try to encourage them to get over that initial hump until their breast milk comes in. So, and it's a little hard for me to know, but it seems like there are a lot of them that will eventually, exclusively or breastfeed or breastfeed quite a bit, but it's hard for us to track that. I'm no longer seeing patients as an outpatient, but I think it's really important to have a good Spanish interpreter. I mean, sometimes I'm not necessarily, the lactation consultant who is Spanish speaking, but just having a good communication system and making sure that they have good follow-up too, because we have resources at our clinics here because of Spanish interpreters, but there's several clinics in town that have Spanish speaking providers. And so we try to get them in with one of those groups so that we can really encourage them to continue. Because I think they really believe that it is really good for babies. They know all the benefits and good for just bonding as well as immunity and CNS development, all that stuff.
And Teresa, I mentioned when we were there that your follow-up appointment and your follow-up clinic can be telehealth because you guys serve a pretty big area. So if there was a specific clinical issue, would your colleague, is it Linda, the Spanish speaking IBCLC, is that her name? Could she do telehealth?
Actually, what we actually do is offer telehealth and telephone counseling for anyone who needs. And I have often, even though I would like to speak more Spanish, I understand more than I speak, but that doesn't work when you're doing counseling. But I have very successfully used our interpretive service here at the hospital in a 3-way call with moms to do counseling, and I have successfully done telehealth. And so the opportunity for families who run across something that is proving a roadblock for their continuation of breastfeeding is available. And I have had some personal success with helping mothers in those situations. So yes, the short answer is yes, we can accommodate moms in a telehealth situation and in a telephonic counseling session, in addition to coming into the clinic.
Right. And it seems like you all have a particular opportunity in collaboration with the pediatric clinic that serves some significant portion of the families that your patients in the perinatal department go on to receive pediatric care at your associated clinic, right?
Yes, so that gives
So-
them the opportunity to refer back with us, or to, send the family back to us if there's something specifically challenging.
Mhm. Right, but I'm just thinking there might be some opportunities, going back to what Dr. Caldwell said about, following to track some patients to see, what
Right.
the outcomes are of the interventions that you guys are making in your in the perinatal department or in the nursery. You could follow up with at least some set of those patients in your associated pediatric clinic. And the same with I remember when we had our leadership meeting, that was a discussion too about the opportunities with the obstetric clinics. And those exist, and some other teams that are participating in the call today have, some systems are more cohesive than others, but there's often opportunities to collaborate across departments and clinics to see what from a quality improvement perspective,
Right.
what interventions are really helping move the needle on your smart aim. So that was a really fun thing about meeting the team there in Augusta. Does anyone else have questions for Dr. Caldwell or Beth Young or me and Teresa as part of the team? Okay. You can continue to add those as you can think of them in the chat. I've got a little bit to share more with you about the site visits. This is something that we started new last fall, and we've had the opportunity now to visit 3 hospitals. We went to the NICU at Eggleston, and you heard from that group in November. If you missed the webinar, it's recorded and available on the team site and also on the GeorgiaPQC.org website. And then you just heard from our Augusta friends. And then we also have been to do a site visit at Atrium Health Floyd. They were very gracious in receiving us, and we learned a ton from them too. Part of the objective of the site visits is, of course, for us to offer your team support, but in addition, for us to learn from you all and be able to bring that inform the Optimizing Newborn Nutrition initiative by what we're seeing when we go out to see all the great work you guys are doing. If you are interested in a site visit, we are looking to do 2 or 3 more NICU site visits, 2 or 3 more mother baby unit site visits this year. So please email me if you are interested. We are also very happy to do kind of a micro virtual site visit if you just want to do some brainstorming, you want some resources about your smart aim, if you want ideas on projects that you're trying to get off the ground. We are also happy to meet with your team or some portion of your team for a mini site, virtual site visit by Zoom or telephone or Teams meeting as well. These are kind of the elements that you heard an overview of from Beth and Dr. Caldwell today. We first have a link to a collector of a specific survey that we'll send you all a link to share with your staff to get anonymous feedback on kind of where your staff feel you are on some standard recommendations from the AAP. And we also, of course, include that leadership meeting, and we can do these in slightly different order. When we went to when we went to Augusta, we did the leadership meeting up front to meet their schedule needs. And then at Floyd, we did the leadership meeting at the end. So Eggleston, we did the leadership meeting at the end and presented survey feedback. So we can kind of work with your group on how you'd like to do that. We love having the hospital tour and meeting with some staff and patient families. As Dr. Caldwell mentioned, the one family that I met when we were in Augusta, I didn't know going in that the baby was only 2 hours old, and Dr. Fairley and she could recognize from looking at the baby that the baby was only 2. It was brand new, but it was fun. The dad was dressing the baby, and the mom was just glowing, and we kind of got to ride that oxytocin high with her. She had just baby had just been to breast for the 2nd time already, and the baby was like 2.25 hours old. It was really fun. And grandma was there, and everyone was just happy. And it was really nice to see the room across from the mom on the wall. There was patient education about Q feeding, right where she was going to see it. It was a fun part. The tour was a really fun part of the site visit. And then, of course, the Mamava pods were cool too. I know it sounded a little bit like a paid advertisement. I wrote some of that part of the slide about the Mamava pods because I'm a little bit of a proselytizer. There's one at the state capitol as well. But there are a really easy way for hospitals to have lactation accommodations for employees that don't necessarily compete with patients, but they can be set up for patients to use, like well enough, like outpatient type patients in a clinic. And they don't require the build out, which, most of you work in hospitals, the process of getting approval for that kind of can be complicated. So if you've got a few square feet to plant a Mamava pod, it can be a great way to meet those needs. Am I still sharing?
Yes,
Let me get back. Okay, sorry, hold on. Let me get back to my slides here. Here we go. So follow up discuss with your group if you'd be willing to have us come for a site visit, or if you'd like a virtual kind of less formal site visit where we could do policy review or brainstorm ideas. We'd be happy to do that. All right. I also would like to share and remind you all that the MBank survey is opening. Many of you may have already been contacted by Battelle, but the maternity practices and infant nutrition survey, if you come to a lot of our webinars, you've heard a lot about this already, but it's every other year. So 2024 is the year. They will open this month and be open through the spring. We are looking to increase our participation rate in Georgia this year. Last 2 years ago, we barely scraped 50%. I think we're 50%. This survey is offered to all birthing hospitals in Georgia. So all of you who work in a hospital should have the opportunity. I think the only exception in the GaPQC initiative would be the CHOA because there aren't births there. But all of our other teams, someone from Battelle will be contacting. Usually it's the mother baby manager type person who receives the survey. The questions are the same for 2024 as in 2022, 2020, and 2018. If you participated in any of those surveys, you should have received a confidential report. It's quite comprehensive that you can review as part of answering, and deciding, getting your group together to decide who's going to answer, be the formal completer of the survey. But it's great to have input from your whole kind of breastfeeding and lactation committee or task force. As you heard, Dr. Beth outlined, that was a suggestion that we had, and I hope that you'll all receive the suggestion that if you don't already have a breastfeeding or lactation related committee or task force, the MPINC is a great little ad hoc project to start one off and kind of see who's interested. Review the questions, review one of your previous reports. If you didn't participate last year, you may have one from 2018 or 2020. And identify who's the best person to actually respond to the survey and who would provide information to inform the questions on the survey. And as you've heard us say before, it's important for us to have as much participation in the survey as possible, because the results of the MPINC survey guide a lot of our breastfeeding and public health initiatives like this one. So the more participate, the more accurate and the more thoughtful the responses are, the more accurate report is that the CDC publishes data, aggregated data for the whole state, in addition to the individual reports that each hospital will receive confidentially. Does anyone have questions about the MPINC? I've asked Summer, and I see she's done this, to drop some links into the chat. I have an FAQ document that we can send out with the slides from today that you could share. But also, if you have particular questions, you can always email the MPINC address there in the chat. Okay. Fun save the date slide coming up. This isn't applicable to the inpatient newborn perinatal crowd, but our quarterly webinar for EPIC breastfeeding program is on complementary nutrition before age 1. So if you're interested in nutrition and starting solids, baby-led weaning, all that fun stuff, if your hospital has a support group, this would be great free education that we'll provide at our quarterly webinar. It's on Wednesday,
Claire?
January 24th. Yes.
I'm sorry to interrupt. Can you minimize the Teams?
Oh, is it covering it up?
Yes.
Sorry.
You're okay.
I'm sorry. I didn't think you could see that. That's the only way I can see the chat.
Okay.
But I don't need to see the chat, so that's okay. Thank you for mentioning that. So anyway, our faculty for that talk is Dr. Taryn Fairley and Dr. Haral Lavanya, who are breastfeeding medicine pediatricians and breastfeeding medicine physicians, and Dinesha Batchelder, who's a IBCLC and pediatric dietitian. Our webinar next month, I'm happy to announce, same place next month here, will be on support journey to direct breastfeeding for the preterm mother-baby dyad. And I'm very pleased to say that we have Dr. Shruti Gupta from Yale. She's a neonatologist with a special interest in neonatal, specifically prenatal nutrition and breastfeeding. And she's going to share some of their work there at Yale New Haven. Registration will open this week for the 34th annual Emory Conference on Breastfeeding. The pre-conference workshop, we had this planned in 2020 when we had to cancel the meeting the week of COVID. So we're happy to be bringing back on April 10th the pre-conference workshop, which will be breastfeeding fundamentals for healthcare providers, 6 hours of both didactic and hands-on breastfeeding fundamental education geared towards physicians, nurses, nurse practitioners, and other advanced practice providers, and medical trainees. So that's a fun thing we're adding. And then the conference, as usual, is 2 days at the Emory Conference Center, April 11th and 12th. The GaPQC will support registrations again this year. So stand by for information from Kimberly on support from GaPQC for ONN participants to attend the Emory Breastfeeding Conference. We will also have on-demand registrations this year as well. And then also make sure you mark the dates, April 25th and 26th for the GaPQC 2024 annual meeting, which will also be at the Emory Conference Center. And then lastly, I just wanted to remind everyone of all the webinars we've done back now to August of 2022 when we kicked off the Optimizing Newborn Nutrition Initiative. All the webinars are recorded, and they each have 1 or 2 micro lessons attached to them. The micro lessons can be standalone or assigned specifically to go along with the recordings of the webinars. This is the first half of them. If you need information on how to register for Georgia Train to get access for you or your staff to the micro lessons, please let us know. Linda or Kimberly or Summer or I can help you get registered for Georgia Train. The recordings are all on the team and on the GaPQC website, and the micro lessons are on Train. Here's the second half of the list. And we are, this is our first webinar of 2024, so we'll be adding in a micro lesson and in association with today's webinar as well. So not everyone's team will need all this education. If you would like, as part of one of those virtual micro site visits, we can suggest some that go along with your SMART aim or specific challenges that you're having, or kind of make a package of basic education. If you'd like, we can help guide. There's a lot, and there will be more as we're, continuing to work through this initiative, continue to be educational resources. We are going to move slightly more NICU specific resources available in this coming up year. But for those of you who are in a mother baby team, there's probably a lot of education that your team or your staff haven't been able to partake of yet that's more foundational or more geared towards healthy term babies. So here's all that information between the two the 2 slides. There's a lot of topics. Does anyone have any questions? I'm looking at the chat now. Thank you, Summer, for adding in. There's links for registration to the coming up meetings, and looks like Teresa's gonna list some of her journal club topics. If any suggestions on journal club topics that go along with the education resources that we have for GaPQC, I'd be happy to take that to our leadership committee for some ideas. I'll pass back to Linda.
Thank you, Claire, and thank you for our presenters and Teresa for all of the great work and for sharing. I did want to let us close with this QR code to just register your attendance. For whatever reason, the QR code does not work, or if it's better for you to do it through a link, I can copy that into the chat right now. But I want to thank you all for joining our January webinar, and we will be back next month. If you have any questions, please feel free to email me, Kimberly, or Claire. We are happy to answer any questions, especially if you have any questions about any of the upcoming events that are coming up. Again, Summer, thank you for Summer for pasting a lot of the information into the chat for us. And again, just let us know. Thank you all. I hope you have a wonderful evening.
Thanks, everybody, and thanks to the Augusta team. WellStar MCG team. I have to train my brain.
Us too. It's okay, Claire.
I bet.
Yeah, we're on name number 4 since I've started here.